There are a few things to discuss with my next guest. One of the most precious things that we can have is our health, and I think we all agree our health system is on life support. A new survey has found that healthcare is the second biggest concern for New Zealanders, just behind the cost of living. Conducted by Ipsos, the poll revealed that 27% of respondents listed healthcare as their top issue, marking its highest ranking in 5 years. Concerns include long wait times, hospital staffing shortages, and access to specialist care. And I'm feeling that the system is generally just under increasing strain. And speaking of strain, Christchurch Hospital's ED, Emergency Department, is facing intense demand. That is prompting them to ask patients with non-urgent issues to seek care elsewhere. Health NZ insists the strain is due to high patient numbers rather than staff shortages. So why are they seeing more patients in ED? Meanwhile, there is a purge at the top. Director General of Health, Diana Safati's resignation on Friday. It's the latest, coming within a week of Health New Zealand's Chief Executive, Margie Upper, and the Director of Public Health, Nicholas Jones. Luxon and Health Minister Simeon Brown have both said the decision was independent and taken by these people. And on top of all of that, with a public health system under increasing strain, more people are turning to private health care to bypass long wait times. Private hospitals report rising demand for procedures like hip replacements and cataract surgeries, with some specialists seeing wait lists double. However, private care remains unaffordable for many, leading to concerns about a two-tiered system where wealthier patients receive faster treatment than while others are left waiting. So as I said, my gosh, that's a lot to take in. So let's jump into it. He's going to love me for this. Dr Bryan Betty, specialist general practitioner, joins me now. Bryan, good afternoon.
Oh, good afternoon, Leah. Nice to be here.
Gosh, there was a lot there, wasn't there, Bryan? There's a lot to get through.
Yeah.
There is.
There's a lot going on at the moment.
There is a lot going on. Can we start back at the survey by Ipsos that revealed healthcare is a top issue of concern? What do you think's driving this surge in worry, Bryan?
Look, I think health is incredibly important to New Zealanders and individuals across the country. It's one of our foremost priorities, I think, from an individual whānau family basis. And I think what we've started to see, and I've been aware of this for quite a long time now, we know there's always been pressures on hospitals, and that's always been there. But what we've really started to see is now access pressures to general practitioners in the community as well. Yeah. And I think that really starts to impact on people when they find, look, I can't get the appointment I need. I'm struggling to sign up with a GP or a community medical practice so I can get my day-to-day medical care. Where do I go if I can't? I end up at after hours or ED or wherever I end up. And that starts to impact an individual basis. And I think what we're starting to see is health is really starting to float to the surface in terms of people's concerns. And look, I think justifiably so, in terms of it is one of the key things, along with, I think, education and housing and employment, of those basic things that we have, that on a day-to-day basis we worry about and we think about. And when this starts to happen, I think there's an issue.
In this survey too, Bryan, they looked at rural communities and came up, they often struggle the most with access to healthcare. I mean, what can be done to ensure they receive the same level of care as those in urban areas?
Look, we know the rural communities have always struggled, and that has traditionally been the case. Look, it is getting crisis level in some parts of the country, and I'm very, very aware of that. And in fact, I visited North Canterbury last Friday, and they were talking about the issues they've got there. So the things that were being talked about is, look, we need to attract doctors and nurses into country areas, and they were talking about things like bonding schemes, or they were talking about things like incentives to get that medical workforce out into the community. The training that happens through the Royal College of General Practitioners, making that incentivising sort of those trainees to go out into the country, because what we do know, if that happens, they tend to more likely to stay in country areas. the other part of it is for medical students, they need to have more exposure to medicine in the community, and
Yeah.
they need to have more exposure to medicine in rural areas. And we also need to be grabbing medical students from those areas. So we need to be setting up systems where we get students who are in rural areas deciding that medicine is a good choice and they can go into medical school, and then we know from all the data and international data they're more likely to go into rural areas. So I think there's a wide spectrum of stuff that needs to be thought about to address the issues we've got in rural in particular.
Yeah, so it just might be my age now, Brian, but I would love to go to a little community or a smaller community and get out of the rat race and be a GP if I was a GP. I would have thought it was quite, beautiful parts of the country, quiet life. I know, although you'll be working. But as maybe also, if you're a doctor and you've got a family, it's the schooling for your children. It's a whole thing, isn't it?
Look, I can speak from experience here because I was, before I came back to New Zealand, a rural GP in sort of near the outback of South Australia for a few years, and owned a practice there. And one of the reasons for deciding to leave that, and look, it was great. The community was fantastic. The work was great. It was a great place to live. Lots of it, lots of work. That's the other thing I would say. And we always struggled to get locums and things like that into the areas, which is always a bit of an issue. But yeah, there are issues that start to arise, like schooling, and the kids got to school age. It's like, what do you do? Do you send them to boarding school? What actually happens in that situation? We made the very difficult decision to leave. But I mean, those are some of the realities that start to happen. So as a system, we need to support doctors, we need to support nurses, we need to support ambulance, we need to support allied health to go into these areas because they are really, really good places to work.
Yeah, I don't know. I just would love to. I mean, I get it. There's more to it than just, looking wistfully out to a mountain somewhere. But let's move on. Christchurch Hospital's ED, my gosh, they are facing intense demand. So much so they've asked patients if it is not life-threatening to seek help elsewhere. And they're saying it's not because they don't have the staff, but the demand has increased and they're not really quite sure. But to say access to GPs was a factor, Dr. Bryan Betty. And we've talked about this.
Yes, we have talked about this, and I think there is a reality to that when the general practice sector is under pressure and is at capacity, then overflow tends to end up in things like after hours or emergency departments. So that is a reality we're facing in many parts of the country. I think these surges in demand that do happen are always the case. There's always fluctuations in terms of what's actually happening. We know that happened with the flu season and winter, and it traditionally always puts pressure on the system. But yeah, we've seen this pop up more often, I think, because of some of the pressures in the community space and general practice space. And for me, that's something that's happening. I know they are doing a lot of work down there for these situations, and I know the ED department there works very closely with the 24-hour after-hours medical centre and tries to distribute demand, and they work very closely. But yeah, look, at times we get these capacity issues. I think these are happening more frequently because of the stresses that general practice is under. There's no doubt about that at this point.
Because it is when I saw the story, I thought, gosh, how do I know that what I've got is not life-threatening? I could go in with a bit of a headache or a bit of a heart palpitation, but if they don't want me to come in because I can't take up a bed, and then you stay at home and you wait, and something it could turn into something that's life-threatening. So that's my concern with this kind of when they say don't come in unless it's life-threatening.
Yeah, so look, you're right. That sometimes becomes very hard for the patient or the person to start to differentiate what is truly urgent versus not. Look, I think there are things like the 24-hour national health line that you can ring to get advice. And I think in that situation, if you're uncertain, it's actually a very good thing to do. There's always a nurse on the phone 24 hours a day that can be accessed to talk to and say, look, is this something I should be getting immediate sort of access to medical care for? And I think things like that, we need to think through things like this in these periods of stress, that there are these avenues to get advice. And if you're uncertain, then you can get the advice. And if you're still uncertain or you can't get that advice, then I think if you've got discomfort, you do need to go to either an after-hours ED or ring your GP, obviously.
Yeah.
In those situations.
Because, I mean, they won't, they're not going to turn you away if you've walked in and collapsed
No.
on the floor.